All right, so pretty excited to have everybody here. This is it's going to be a fun day. We're going to talk about a couple of different things today. The first, I'm going to call out the elephant in the room. There's been a lot of change. I know that. The way that some of this change has been communicated, the way that some of this has had to occur, I can't apologize enough for having to keep some of you in the dark about what's been going on. I know that's been scary, and I apologize for that. Unfortunately, the UK government only gives me so much leeway in some of these scenarios, and so some of this we've had to step through lightly, and we've had to step through quietly. And again, I appreciate your patience as we've done that. I know it's not easy. I feel terrible. But today is all about new beginnings and about being able to move forward together. And I'm going to answer as many of your questions as I possibly can. I'm going to try and open this up as a great time period of radical transparency. I like that. That is my default stance. And so that's where I want to move forward together. Does that sound okay? Perfect. So starting there, you've seen this before. It's about who we are as an IT organization. And I think it's first, before you can answer a question or know where you want to go, or know what you want to achieve, you have to know who you are and what you're trying to do here and what you're trying to accomplish. What are your goals? And so you start with our mission, vision, and values. And so our mission as an organization, it's pretty clear. Above all else, we're here for the improvement of the care and improvement of human life. That is huge. It doesn't say anything about technology in that, but technology is a huge part of it. 26 million patients were impacted by the technology that you serve every single day. That is huge. So that's our opportunity. Our vision is something you've also heard. We've been talking about this for some time. Creating these incredible customer experiences. That is where we have this opportunity for our patients and for our clinicians, for every single person we serve. And out of this, we're going to have 4 values. And the values, as you'll see, they don't have definition. And I want to save that because we're going to define them together. We're going to do this activity together. In my mind, these 4 values, experience-driven. We'll talk about this a little bit later today as far as how we're structuring ourselves and where we're going. But driving great, incredible experiences every single day. Innovation-minded. Being able to think about the future, think about what's next. That is where we live. That's our bread and butter. That's our opportunity. So we've got to be fearless in our determination as far as how we do that and how we approach it. And then execution focused. All the great ideas in the world don't mean anything if they never get done. We've got to deliver. We have to execute. Execution is innovation's partner. Without it, doesn't matter. We put a bunch of great ideas that change the world, but if they never leave the room, they never will. So that's our opportunity. We can go back on this one quick second. Does this feel right? Does this feel good? Okay. Good. Let's welcome to the new IT. So the new IT organization is predicated on two different concepts. One, it is built on the concept of driving incredible customer experiences every single time. It's also predicated on the idea that you cannot do it alone. There are no more silos. There are no more individual contributors. There's one team working towards one goal. If we don't hit that, if we don't do that, we fail. If an individual has to feel like they're pushing a boulder up Everest by themselves, we will fail. This whole model is predicated on the idea that we come together as one team, as one organization, and we make a difference. That is our goal. That's our opportunity. So in order to do that, we've got 4 key experiences that we are going to focus on. And of these, every single one is going to be a new organization within the within IT&S. Because every day we need to have folks that are dedicated to driving these new experiences, to driving this new level of capability for our organization. So we start with our consultants. We need an organization that's whole purpose is making the lives of our consultants easy and the way they interact with our technology frictionless. That is our opportunity. That differentiates us. That's going to bring more consultants, more GPs, more professors, more folks into our organization, and that's going to drive volumes, which impacts our business and allows us to impact more people and our communities in a broader fashion. Clinician, we've got to be able to focus on all of our clinicians, whether it's our nurses, whether it's our lab techs, our rad techs, regardless of who it is, we're here to serve our patients. And we've got to make sure that we have a team that's dedicated every day to driving that experience for them, to making it an incredible experience every single day. Our end users. So, it's funny, as I've talked through this, everybody's like, what are our end users? That's everybody else. That's everybody. So we've got to have teams that are dedicated to making sure that everybody has this great journey and that all the technology that we use works and works very well, and that it helps deliver these experiences that we want to achieve. And then our patients, our most important population. And I leave this up to a very simple phrase. We need to have a team that makes it a seamless transition from I feel bad to I feel better. That's our job. That's our opportunity. And the great thing is we've all been in that space. We've all felt bad. Wouldn't it be great if feeling better was really easy? Because who wants to go through a bunch of pain in the rear whenever you're feeling sick? When you've got a high fever? When you've got children that are ill or not feeling well? That's not what we need it to be easy. And technology can make it easy. And so this is where we have the opportunity. So, meet our 4 new organizations within IT&S. These are our experience driving services. They're here to drive an experience. And the great thing is none of them exist in a silo. While the focus is to drive a great end user experience or a great patient experience or consultant experience, everybody works together as an ecosystem in a hospital. So all these groups work together in IT to support that. So that is where we go. The other side of the coin. We've got all these great experiences. How do we support them? Meet the 4 additional organizations in IT&S. These are our experience support services, here to help support those teams that are driving those experiences every day, as well as our customers. So the first, strategy and innovation. Today, driving a great IT strategy, pairing it with our business, and we'll get a chance to take a look at that a little bit later, but also being able to drive disruptive innovation in our organization. I think if you look around, you pay attention in the news, you look at the media, there's great opportunity for technology to improve the way that we care for patients. It touches every part of the patient experience. It touches every part of a clinician or a consultant's journey with us. So why shouldn't we be able to make it great and start looking about what's next? Infrastructure operations, being able to have a group that's specifically designed and focused on driving an incredible infrastructure from voice to video to network across all mediums, as well as our cloud infrastructure, and being able to have these folks present a unified platform for everybody to be able to build, create, and deliver on. It's exciting. Project delivery. This is one where this is all about execution. Driving execution, driving the ability for us to make a difference and to see these things through. And so our project delivery team is centered around that concept of execution. And then also being able to create a new IT Center of Excellence, which I'm really excited about because it's all about capturing the things that we do so we can tell the story back to our business. What is the impact that IT is having on our organization? And how do we articulate and tell that story? The IT Center of Excellence is where that's going to be able to live, and the group that's going to help us deliver it. And then our information security and data governance. In this day and age, one of our most important organizations because they protect our valuable information assets and our data. And so we need to make sure that we have a really strong focus and best practices and the right tools and technology in place to be able to deliver here. So you have 8 teams, all working together as one. That's the concept. 8 teams working to deliver an incredible customer experience. Regardless of who you are, regardless of where you live, everybody working together. That's the goal. So, I figured that I may get chased out of here with pitchforks if I didn't show some level of org chart. So I wanted to be able to demonstrate how this looks. And so I wanted to show you the top level. And the reason I'm only going to show you the top level is this, because every single one of the heads of department that we bring into this organization structure is going to be able to then have a role in dictating everything that lives underneath it. All of the positions, the manager roles that they need, the lead positions, all of those areas, I really need that head of department to be able to help develop. And so since we haven't hired all of the HODs, I don't feel it's fair to be able to show you something that may not end up being the end result. Now, as we're going to get to in a moment, there will be certain requirements that I'm putting on each of our heads of department as they step into these positions to create a level of equity amongst each of the different groups. And so we'll chat about that in a moment. But this is what it looks like. We filled some of these positions. A couple of changes from how things looked before. We are hiring a Chief Information Security Officer. Again, as I said, this day and age, it would be foolish of us not to make sure that we have the focus and the investment in information security. They protect us and also make sure that we build a security-aware culture. And so we're going to hire an individual to help drive and lead that organization. Head of IT Project Delivery. This is a position that I'm very happy to announce that we have just hired an individual for. Her name is Christine Hart. Christine has delivered a substantial number of projects in Nashville, working in the ITNS project management team there, and multi-million dollar programs. She's absolutely fantastic. Everybody from Marty Paslick to Shazad to Lee Adams to Paul Conley all said I'd be crazy not to hire her, and when I met her, I felt I completely understood what they said, what they were saying. She wants to move here. She's got a small child and her husband works in Afghanistan, and so this is huge for her, being able to live closer and be closer to her husband. Huh? Oh. And then everything else here is really, so I'm really excited to have her join our team. I'll send out an official announcement here shortly, but I was just wanted to tell you it's hot off the presses, so really excited to have her here. And then the rest of this is we've hired Andrew Platts as our head of infrastructure operations. And we've also moved Ola Spencer into our head of IT strategy and innovation. Peter Eshkari, who Peter's still on holiday, but he won't be upset if I tell you he's moved into our clinician IT experience. And so the rest of these positions, our consultant experience, end user experience, and patient experience, these roles will all be opened up today. So we'll get all the rest of these positions opened up, and we're moving quickly to get them hired. So very excited about that. Okay, so there will be more. We will share more. What I'm going to ask you towards the end of this is, how do you want to be kept up to date as we step through this? Again, the concept of radical transparency. I want to be very open and honest about where we're going. Obviously, in our end user experience team, we've already hired Mr. Quincy McDonald to head up our end user service delivery. So excited about that. And we'll continue to look at building this new capability along the way. And whatever HOD comes into this position, they'll be blown away with Quincy as I am. Right, Quincy? Yes. All right. So the really important question, what's in it for you? Why should you want to be a part of this organization other than a paycheck? Because I can tell you right now that this is not about paychecks. This isn't about I'm here to do my 9 to 5 and go home and call it a day. If that is the type of role or organization you're looking for, I'll tell you right now, this may not be it for you. Being honest. I need people who are going to be evangelists of our mission, believe in what we do and are passionate about it every single day, that live and breathe wanting to make a patient's life better, want to improve the clinical experience, want to drive our experience organizations, and feel that technology has a role in making healthcare better. That's what I need. That's what I want. If that's you, there's going to be a place for you in the new organization. Promise you that. If you're not, it's okay. Let's have that conversation and let's step through it. Because I'd rather you know that now than not be able to then participate and just show up, because it's just not going to work. I'm going to call out what I've put here. This is one, like I said, one organization working towards common goals. No more silos, We're one IT organization. That's who we are. That's where we are. That's who we're here to serve. We're here to be together. We have to be together. This organization, I'd say the number one piece of feedback or the number one thing I noticed is that we, in pockets, work well together, but we aren't together. That has to stop. We're bulldozing the silos. We're bulldozing the walls that divide us. We can't do it anymore. So I need your help with that. A couple of points. This is all about creating a collaborative, customer-centric organization. We're all working towards the same goals. We're flattening the management structure. I am a huge believer in changing to make sure that we don't have 93 levels of managers and you don't have any touch base with anything that's going on, because you've got to take a message through 19 steps before you can actually get a decision on something. If you felt that level of bureaucracy, it exists, but no longer in our organization. Every single one of you is empowered to talk to whomever you need to in order to get things done. That is the expectation, in fact. If you need to talk to me to get something signed, if you just need to bounce an idea off, as I've told you in each of our one-on-ones that I've had so far, I 100% want you to do that and expect you to do that. I'm here to serve you. I'm here to help you. That's my job. One of the things that was really important for me is being able to create a journey, a pathway, different career paths for people in this new structure. So in order to do that, it's recognizing that not everybody wants to be a manager, and that's okay. I really want to make sure that we put people in manager positions that want to be a manager, that they want to lead a team, and that's what really gets them excited every day. And if you don't, that's okay. We're going to create at least three levels of non-management roles in every single one of these organizations. So I started talking about some of the requirements that I'm going to levy across the board. This is one of them. You'll have lead, senior, and then entry-level positions in every single one of these organizations. For our more technical teams, we're going to have architects, administrators, engineers, and entry-level positions. We're going to have great opportunity for you to move within a non-management path as well as in a management path. We're going to build career paths for you. We're going to help create development plans that help guide you through this and get you to where you need to go. And look, we're going to invest in you. If you need training, if you need certifications, whatever it may be to help you along your path, we're going to invest in that. Because if we're going to take the time to move this organization forward, if we're going to invest in this level of structure, we got to invest in you. You're the part that makes this work. So that's where we've got to live. Part of that is going to be mentoring and job shadowing. Really excited to get these initiatives off the ground. This is what's in it for you. Being part of an organization that's a family, that's everybody together working towards common goals, making a difference in people's lives every single day, having great opportunities in your career to grow, develop, having an organization that invests in you and that wants to see you succeed. From there, it's about making sure that we do the right things, that your ideas and your voice are heard. All of this is part of this new model. All of this is a new level of expectation. This is the new ITNS. This is what I want you to be a part of. This is what I've been excited about sharing for a very long time now, and I'm glad that I'm finally able to. This is who we are. When we first got together, I promised you that we were going to talk about we wanted to develop a strategy and then an organizational structure that aligned to that strategy. So I want to talk to you now about that strategy and how the new organizational structure aligns to it. See, it all worked out. So these are the 4 strategic tenets that we're taking into our strategy for 2017 through 2019. The first is building these great experiences. And if some of this looks familiar, I snuck it into some of our other conversations. Sneaky. So the first is delivering these great experiences, which we've talked about today. The other part of it is the role that data plays in our business. Data is our differentiator. Data will be how we personalize medicine, how we make the experience great in all these different areas. Data is a huge part of our organization and our business structure going forward. And our business partners, our senior team, they completely buy into this. They know that it does. They know that the role that data plays in it. And so we have to make sure that we have the right alignment to that. As I've committed to you before, we're going to work on the things that matter most to our patients and to our clinicians. We've got to get away from busy work. We've got to get away from work that checks boxes but doesn't deliver value. We've got to move away from that world. That is what we're committing to here, is moving away from that. And so that's where the role of resource management comes in. And I know right now it's not so fun and having to work in Excel spreadsheets and having to think about that. But this is how that data that you provide me is exactly the ammunition that I use to make sure that we do this, that we are always working on the things that matter most. And you have a role to play in that. If you don't feel like something that you're doing is adding value, you need to raise your hand and say, this does not feel like it's aligned to our mission, vision, and values. I think we should stop doing it. You are empowered to do that. From today going forward, you are empowered to do that. That is the expectation, not the rule. I need your help in this. The last bit is what we talked about earlier, enabling a level of disruptive innovation in our organization. And you know what? Disruptive innovation does not happen in a bubble. Innovation does not happen in a bubble. Innovation is about all of you and your ideas and being able to harness that. That's about an army of change agents seeing a better way, raising their hand and saying, I've got an idea. That's it. That is where things happen. That's where change happens. That's where we make a difference. And so we are going to enable this across our organization and think it's really key for our success as a company. These are our 4 strategic tenets. So what does our plan look like? So we've aligned our mission, HCA's business objectives, to the tactics that we are using underneath. These things are how we deliver each of these bits, because IT strategy is a part of the business strategy. And all of this will be sent out to you today, so you'll have a chance to look at this entire deck. I don't expect you to read through all of this, but you and all of your teams touch you touch something on here, probably many things. This isn't all we're going to accomplish, but these are some of those key tactics and some of these areas that we're going to be delivering a difference in. So, This is the first time that our senior management team in HCA UK has seen something like this. I sent it to our governance. I sat in front of our governance board yesterday, and they couldn't be happier. They're excited about this. They like that we are aligning to them. They like the fact that we are putting in capability that enables them. In fact, They want to make sure that we've got a whole lot of runway to be able to deliver these items. So when we talk about having the buy-in that we need in order to slim down our project list and focus on the things that matter, we've got buy-in all the way from Mike and Teresa all the way down to make sure that we do that, because they think that this is important enough to be able to make sure we can do it. That's huge. So, like I said, I'll send this out. Don't you have to read everything. It's a little bit of an eye chart, especially for the folks in the back. But very excited about it. So before we move on to how we get there, I just want to be very cognizant of the fact that we've got a lot to do. We are going to grow in order to do it. We've got a lot of different teams represented today in this room, if you haven't noticed. It's a little bigger group than it was last time. We've got our friends from Health Trust Europe who are going to be a part of our IT&S organization and helping us to deliver capabilities. So thank you to them for coming from Birmingham to join us today. We've got our friends from HRIS. We've got our friends from LOC, from Rude Lane and Blossoms, because we're all part of a family. We're part of a new IT&S family, a new IT&S direction. And I wanted to make sure everybody was represented here today to share in this, to be a part of it, to be a partner in it. So if you haven't had a chance, say hi to somebody you may not know today. So it's a question of how we get there. And I'm going to go through these really quickly because we've hit on a lot of this. refocus and restructure the organization. We're going to develop the processes to do more. We're going to cultivate this great culture that we need to work towards of service, innovation, and execution. We're going to strengthen our pipeline, and that's investing in each one of you. And we are going to make sure that we do something that does not feel like it has happened in a really long time. Shut up and listen. That's what I'm going to do. And that's what every single one of us needs to do, is listen, evolve, take the great ideas and opportunities, and continue to move. This is a big move. This is a big leap. This organization has stayed somewhat static for a very long time. So we had to make a big leap. From once we make the leap, steady evolution. That's how we will continue to move forward. So, focus on the key experiences. The one thing I want you to take away from this in each of the experience teams is this question. Every morning when I wake up, I am here to deliver an incredible experience for who? This is the first thing in your mind. What am I here to do today? We may make that dead simple. And if you are in one of the experience support service lines, every day I'm here to drive an incredible experience for every single one of these groups. That's where you're at. Develop the processes to achieve more. This is where we start looking at things like process execution. So being able to change the way that we intake and prioritize our projects, doing resource management, and making sure that we have a strong IT governance framework in place. This may sound boring, but this is the underpinnings to make sure that we focus on the things that matter most. Without this in place, it's chaos, and we've lived in chaos for far too long. Cultivate that culture. This is where we want to live. So I'm gonna read this because I really do think that it's key. We have to ensure that every member of our IT organization knows that our role is to serve and enable our business, and underscore that word serve. We are here to serve. As I am here to serve you, as our leaders are here to serve, we are here to serve our broader business and our patients. Regardless of your role, what you do in this organization, you're here to serve. Innovation is one of the greatest expressions of how we do that. It's not a mindset I think that we've thought about, but the fun thing is over the past several weeks to a month and a half, I've seen some people come forward with some amazing ideas. And I just want to enable and empower you to drive them. And execution is what it takes to turn great ideas and turn them into movements that change the world. That may sound corny, but God, I believe it. And there's no bit of me that does not think that we have the ability to change the world one patient at a time, one person at a time, one consultant clinician, one rad tech, one phlebotomy tech. It does not matter. We are here to make a difference, and you can. You are empowered as change agents to do good or do not so good. What will you choose? Strengthen the pipeline. This is all about developing our talent, because I really do. Without you guys, this does not work. Without having the right people in the roles, without empowering you, enabling you, growing and developing you, this does not function. This does not work. None of this happens. So we need to provide those guided development plans. We need to be able to coach and mentor you based on your strengths, and we need to be able to intentionally train and certify every single one of you for the roles that you need to get into. And that does not need to be a burden on you. That needs to be a burden on us. Because it's not a burden. It's the only way we drive our business forward. Last part, I could say shut up and listen, but it just doesn't sound as nice. So this is where I want to enable you and your ideas. This is where I want to grow and empower you. This is where I want to give our customers a voice. Give our customers, let them be a part of this experience. Come together. It's not IT in the business, it's one. It's one organization working together. It's all these people working towards similar goals. This is what we can enable. And the last bit I think is really important. We put this culture in place. It is up to us to defend it. Every single one of you has to hold every single one of us accountable to this culture. Your peers, those in manager or lead or director roles, it does not matter. Holding accountability to our culture, to where we're going, to our mission, vision, and values, that is everybody's responsibility. If we don't do it, it dies. If we don't do it, it wasn't important enough to us. And if it's not important enough to us, then why are we doing it in the first place? This is where we have to dig our heels in. This is where there is no exception. We either believe in this, we drive it, we're passionate about it, and we want to deliver, or we don't. As the great philosopher Yoda once said, do or do not, there is no try. And that is where this comes in. We either do or do not. So, I'm going to end. I had to give a little Kennedy here. I couldn't help myself. But this is one of those things that this change of our organization is not about correcting the sins of the past. This is not about everybody's done a really bad job and we've got to change it. This is looking to the future. This is looking to the future of healthcare, the future of what we can deliver together. This is the future of our organization. That's what I wanted to highlight here. That is what is the main driver behind this change. So I'm going to end with this question. I don't ask this question lightly. This isn't a question I need you to answer today. But this is a question you're going to need to answer. And deep down in your gut, right here, you have a feeling of whether or not you're in or not. You have to be in. If you're not, that's okay. It's okay. We'll have that conversation. We'll work through it. We'll make it nice and we'll make it seamless, and we'll work through that together. But I need people that are in. I need you to want to be a part of this. I need you to believe it in your bones that this is the way that we need to move forward. I need you to believe in our mission, our vision, our values. I need you to want to be a part of this change. There will be change. But like I said earlier, if you believe in it, if you want to be a part of it and you are active in it, there is a role for you here. If you want to make a difference every day, there's a role for you here. That's it. All right. That's all I've got. The fact that it's been upgraded to a suspected terrorist incident. What I'm asking, what I'd like to do is to avoid the mass, you guys